I'm a good kid, I'm a valedictorian, I play baseball, like I don't really need God. It was the first time in my life I was like, I need something other than me because I can't get through this. Through those injuries, through that process, that's where I felt like the Lord really spoke to me and really showed me like, hey, like there's more to life than just yourself, there's more to life than baseball. And that's really when I just surrendered my life and said, all right, Lord, I'm just gonna give my life to Christ, I'm gonna follow you. I want to walk after you and follow you, and I want what all those other people have been talking about. I want that kind of joy, I want that kind of happiness, because I'm not finding it in myself. I'm not finding it in baseball. I'm not finding it in any of that. And I was very lucky to have some really good sports medicine doctors that did my surgeries and really kind of helped me when I was in a very low spot. And it really kind of like put a bug in my ear that, you know, I want to be able to do something like that. I want to be able to kind of help people and kind of lift people up in their lowest moments. I don't know what I want to be when I grow up, but I want to help people like my dad helps people.
Oh, that's great.
I want to impact people the way my dad impacts people. I want to be able to make people feel the way my dad makes them feel when he helps them, you know, in the operating room or in the clinic room.
Some of my pro guys and pro girls I get to work with, the one that tend to cope really well with adversity are the one who has the most faith, right? Because they can walk, lead by faith, not by sight, which is the best thing you can do. And, you know, rehab is messy. Like life is messy. It's never gonna go directly as planned, but there's always a reason why you're put in that position, because you don't know what kind of impact you're gonna have.
I'm a big believer that in medicine and in our line of work, your patient is your biggest teacher. Everything you need to learn about your field can be found in the patients you treat. And I think just listening to the patients and seeing, you know, you just observe trends. And as I talk to these patients and observe those trends, I was like, man, these guys are like, they're ready. Like I'm holding them back.
Hi guys, welcome to another episode of the Myokinetix podcast. Today we have a special guest, Dr. James Carr. He is one of the best physicians that we like to refer to. He's with HSS, so we trust him with all of our athletes. The reason why I want to have him on this podcast is because not only has so much knowledge when it comes to UCL, ACL, but really his experience as a college athlete himself really shaped the way he treats our athletes as an individual and help them get back on the field with full confidence. So we're going to dive in, we're going to nerd out a little bit, but honestly, we're just going to have a good conversation where you guys get to know Dr. Carr as a person first, and then how he is as a physician, as a orthopedic surgeon. So Dr. Carr, welcome to the show.
Thanks for having me, Natty. Good to be here.
Yeah, so I want to get into it because I saw your presentation 2 weeks ago, and I thought it was great, especially the way you were talking about how you're modifying the throwing protocol now, right? Because before, well, in the past, right, we stuck to the same throwing protocol for 12 weeks, and then people started layering in different periodization, as you would say. But now, during that panel you were on, you mentioned that some pitcher get to start throwing a little bit earlier based on baseline velocity that they have, where MLB guys who throw like over 100 plus, they have to then start later. So can we talk more about that?
Yeah, absolutely. So thanks again for having me. Great to be here. So I love treating these baseball athletes, throwing athletes. And, you know, we've seen a big shift, I think, in how we rehab these athletes. And a lot of it is based on what we've learned about the rehab process and really how we've changed some of our surgical techniques. So when I was a fellow, even just 7-8 years ago, we were just doing standard Tommy Johns, where we took a graft from somewhere else, a tendon from the wrist, a tendon from the hamstrings, and used that to make a new ulnar collateral ligament in the elbow. Now, we're not only doing that, but we're adding in additional support to the elbow, like the internal brace, which is basically a very strong surgical suture that helps support the elbow. And what we've found, and what I've definitely found in my practice, is that a lot of kids are getting through the rehab process more smoothly. They're having less hiccups. And when they do start throwing, they're able to accelerate a little bit faster through that throwing program. And so kind of serendipitously in my early kind of first 4 or 5 years of practice, I would have kids come back and they were months ahead of where I would expect them to be based on the classic timeline. And they were able to start throwing a little sooner. They were able to make it through the throwing program a little faster. And basically I would have high school kids coming back at 8 months, 9 months, 10 months, asking for me to clear them to return to sport. And I was kind of shocked the first few times and asked what they were doing and asked where they were at, and they were ready. You know, they had the right numbers from their physical therapist. They had the right, progression through rehab, and I let them go back, and they did great. So I think a lot of people in the industry have been trying to push it back and throw later and throw longer and delay the return. But there's also this other movement that me and some of my colleagues are doing, where we're trying to get them back faster. So we've seen it play out pretty well, and the goal is that a Tommy John surgery doesn't have to be a 1.5 to 2 year recovery of what it is now. Hopefully it can be like an ACL now, 9 to 10 months, maybe 12 months, depending on the sport, depending on the athlete.
Yeah.
So we'll see. We're still working on it.
Yeah. So I think that's what's great, right? Is you're not one of those guys where like I've been practicing for X amount of years, so this is my absolute knowledge. Where you're open to having conversation, and the way I practice as well. Like there's some cases where it's like, okay, this is a textbook case, and there's a certain case like, whoa, this is. I mean, like the joke I always make, like this person's healing like Wolverine, like
yeah,
I mean, they're
exactly.
doing so well. And the one thing you and I can agree on this, where if you hold people back too much, then they start having some resentment towards the whole thing, and then they're gonna go do it anyways.
Exactly.
So I'd rather say, hey, let's just do it together. I'll give you a little bit,
Yep.
and then if you just respect the boundary I give you, okay, then we can have that conversation.
Absolutely. No, I think that's the perfect way to do it. And I'm a big believer that in medicine and in our line of work, your patient is your biggest teacher. And everything you need to learn about your field can be found in the patients you treat. And I think just listening to the patients and seeing, you just observe trends. And as I talk to these patients and observe those trends, I was like, man, these guys are like, they're ready. Like, I'm holding them back. Kind of like what you were saying. I was telling them you can't throw till 5.5 months. They're sitting here at 4 months, 4.5 months, ready to go, and they're bored. They're bored at therapy. They're doing the same thing for 6 weeks just for the sake of, really just because I told them they had to wait. And I had some kids that, to your point, were like, hey, I'm just going to do it anyways. And they come back and say, well, I started throwing 6 weeks ago. And I was like, oh, you did? And I just listened to them. I talked to them. And I really tried to understand where they were coming from. I called their physical therapist. I talked with them. I talked about what they were seeing, what their strength numbers were. And just really learn, like, this might be an area where I need to shift my paradigm a little bit, and I need to adjust how I'm thinking based on, how these surgeries are going and how the rehabs are going. So to your point, it has to be the right patient with the right surgery, with the right physical therapist. But if you get those combinations correct, then I think there's great potential for some really successful results that can beat some of the averages.
Yeah. So, I mean, what I love that you obviously you love having conversation with the patient, which is great. And you're a second generation physician?
Actually, third generation.
Third generation.
So my grandfather was an orthopedic surgeon, my dad was an orthopedic surgeon, and I am as well. So, and I didn't plan on that, but it worked out that way.
But talk me through about that. How did that play an impact in your life as a young man, and then also as an athlete growing up?
Yeah. So it was great having an orthopedic surgeon dad, because he could diagnose all of my aches and pains as an athlete. But no, it was great. So I was very tunnel vision as a kid, like most kids are. I played baseball. That was my sport of choice. I played other sports, but baseball was always my first love. And I had no idea I wanted to be a doctor. I wanted to play baseball. That was my life. I wanted to play professional baseball. I just always told myself I'll play at the next level. I'll just focus on getting to high school ball, and okay, great, I made varsity as a freshman. Okay, now I got to make college ball. All right, I'll play in college. And then I just always thought, oh, when I get to college, I'll just somehow go to pro. It's just what I do. I'll find a way. And so I didn't even know I wanted to be a doctor. But I was bored one summer after, I think, my freshman or sophomore year of college. And I just went into work with my dad one day. I was like, Dad, I just want to see what you do. I just want to shadow you. I want to hang out and see what you do. And I was blown away.
Wow. What was his reaction?
He was happy. Like, I think, like, deep down, like, I could see like a smile, because like trying to hold it back. Like he never. The thing I love about my dad is he never pushed me one way or the other. He never forced me to be an athlete. He never forced me to practice baseball. I wanted to do it. I loved doing it. He never forced me to go into medicine. He never even expected me to go into medicine. He always told me, I want you to do what you're passionate about. I want you to find that passion and do it. You'll never work a day in your life if you're passionate about it. And whatever that is, go find it and do it. And I just was kind of bored. I was like, all right, Dad, let me just, Mom says I need to get out of the house a little more. Like, let me go shadow you. And it was amazing. Like, I saw this whole other side of my dad that I never knew existed. I knew it existed, I knew it was there, but I'd never witnessed it. And he was just so amazing with his patients. He was so amazing with his staff, with everyone in the hospital. We'd be walking down the stairwell to get to the cafeteria for lunch, and he would stop along the way and talk to the janitor and ask how their family was doing, ask how the janitor's shoulder pain was. He knew these people, he cared about them. And, his patients came in and he cared about them, and he talked like a normal person to them and really would joke with them. And it was never like, I'm the doctor, you're the patient. It was, we're here together, we're trying to help, we're trying to make you better. And I remember walking away from there being like, I don't know what I want to be when I grow up, but I want to help people like my dad helps people.
Oh, that's great.
I want to impact people the way my dad impacts people. I want to be able to make people feel the way my dad makes them feel when he helps them, in the operating room or in the clinic room. I didn't know that was going to play out being a doctor, but I knew like from that moment on, like I want to impact people like my dad does.
Well, I mean, we all know medical school is daunting and challenging,
Yeah.
right? So I think having a strong why like
Yep.
that definitely pushed you through, right?
Absolutely.
I mean, like how many times do you play that scenario in your head when like you have an exam and you have to do all these things?
Yeah, no, absolutely. It's a grind. It's a 10-year commitment post-college. So 4 years of med school, 5 years of orthopedic surgery residency, a year of fellowship. And so there are many Friday nights where I'm up late at 8, 9 p.m. studying and I'm like, why am I doing this? But I would go back to those moments of, I'm doing it because I feel called to do it. I felt, like it was kind of my life's calling, and I wanted to kind of help people in that way and impact people.
And so you ended up playing college ball, and you were doing college ball and also pre-med at the same time?
Yes, but I was not, I wasn't your prototypical pre-med student.
Okay.
So I kind of joke that I had a trajectory that was just very unique. I think most of my pre-med students, like co-students, they were all in, like, pre-med was their job. They volunteered all the time at the hospital. They set up their whole college, curriculum to get to med school. I came into college and I was like, I just want to play baseball. And I just want to, get a good education and go from there. I played Division I baseball, so that was like a 40 to 50 hour a week job. I didn't have time. I didn't go to any pre-med meetings. I didn't have time. I always had practice. My sister would go to them because she was a pre-veterinary student. So she would kind of go and give me the notes. And I didn't really pay attention to pre-med. I didn't know what I wanted to be as a major. I picked neuroscience because I love science.
The hardest kind of science.
Yeah, the hardest. Yeah,
Neuroscience.
Neuroscience. Yeah. So I picked neuroscience, and I just kind of got to the end of my junior season, and I'd had some injuries, and I just realized, I don't think this whole baseball thing is going to work out. With a neuroscience major, I could either like flip burgers at McDonald's, I could get a PhD in neuroscience, or I could go into medicine. And so I was like, all right, let's just go into medicine. And I just picked that path. And I was thankful it worked out the way it did. I think the good Lord was looking out for me. But I think also it gave me the advantage of, kind of like, I'm not comparing myself to Patrick Mahomes in terms of his level of greatness, but I think one thing that makes him so good at what he does is when most of his colleagues were working with quarterback coaches and they were getting a lot of things coached out of them. He was playing baseball, he was playing basketball. So no one taught him, hey, don't throw a football sidearm. Don't throw across your body. Don't do these unorthodox things, because he was playing all these sports. He never was in an environment where things were coached out of him. He just was who he was. And so I never learned how to like talk like a doctor or act like a doctor or, learn some of the stereotypes that I think a lot of doctors have. So I just know who I am, and I just act like myself. And I was lucky to have mentors along the way that didn't try to coach that out of me. They would say, look, you're kind of casual in the way you talk to patients, but it works and patients like it, and you connect really well with them. So keep doing it. And I just kept doing it, So I wasn't this very formal, like, oh, I'm a doctor and this is how I talk and this is how I act and I have to be perfect. And I was like, this is just who I am. I've never known anything differently. So I never had some of that like, human connective ability coached out of me.
I think that's a good point you brought up, because we obviously you get pigeonholed into the identity that you're going to be doing, and obviously the white coat syndrome is real,
Right,
where you start using big medical jargon and people have no idea what's going on, and people are fearful, being in pain already, and you're throwing big words at them. They're like, "What is happening? Is that cancer?" Like, like chances are they're probably going WebMD. They're like, "Yeah, it's everything ended in cancer."
Yeah, exactly.
Right? So,
or you need your arm amputated. Yeah.
So I think it's. I mean, if you're gonna white coat syndrome patient, you might as well wear that suit that they used to wear during the plague.
Yeah. Yes.
Because you're just unapproachable.
Exactly.
Yeah. So I think that's amazing. And I think being around the clubhouse, seeing your teammate get injured, and then seeing what they're going through, the frustration. You also got some injury yourself as well, right?
I did. Yeah. So that also kind of was a big moment that pushed me towards sports medicine. So again, I was kind of living my whole life for baseball. My junior year, which is the biggest year for baseball recruiting, kind of your junior season, junior summer, I was playing on a very elite travel team. I was starting to get Division I looks. I had coaches contacting me. Everything was kind of going the way I wanted it to. And then randomly, I was diving for a ball as a catcher, and I landed on my shoulder, and it popped out of place and popped back in. And I was like, oh, that feels kind of weird. And I kept playing, but it wasn't right. The whole summer, I could feel it kind of shifting and sliding, and it wasn't a strong shoulder. And then at the same time, from all the catching I did, I developed a stress fracture in my right foot. And so I get to the end of my junior, travel season. I'm trying to go to these showcases, trying to go to colleges and get looked at. And I just couldn't play. I broke my body down. The stress fracture wasn't healing. My shoulder kept popping out of place when I would swing. I couldn't put my best foot forward. My looks were getting less, and I basically had a decision. It was, kind of October, November of my senior year now. And I could either just, kind of give up on baseball, or I could get surgery and try to get back. And being the knuckleheaded 17-year-old kid, not understanding what surgery meant, I said, well, let's just do them both at the same time so I can get back for my senior season, because I have to play baseball. That's my life. I've worked my whole life to be a baseball player, and I'm not going to miss out on my chance to play college ball because of a silly injury. How bad can it be? And so I had surgery on my left shoulder and my right foot at the same time. So I was in a cast on my right foot, a sling on my left shoulder. So I couldn't use crutches because of my shoulder. I couldn't walk because of my foot. And so I had to be in a wheelchair. And I was actually in a wheelchair for 10 weeks. And that was very, very humbling. To be driven to school by your mom, to be wheeled into your first class by your mom in a wheelchair. And then, at first it was kind of cool. Like all my classmates kind of pushing me around in the hallways. And then after a couple weeks, all my classmates would try to leave really fast. So it's like, come on guys, somebody help me. Who's going to push me? They didn't want to tag you it. Nobody wanted to do it anymore. It was really humbling. And college coaches were calling and wanted me to come up and talk about scholarships and go on visits. And I would tell them I had some surgeries. I'm in a wheelchair. I can't go. And I'd never hear from the coach again. They would just say, hey, good luck, and we'll check back on you in the spring. They never checked back. And so my whole life was just crumbling before me. And I was just really devastated. It seems like a minor thing, but in a 17-year-old's eyes, it was the worst thing possible. And it ended up being the best thing for me because, at the time, I grew up in a family where we went to church, we had a lot of faith, and it was always part of my life, but it was never personal to me. I was always hey God, if I need you, I'll just kind of, holler at you if I need you, but I'm just gonna live my life. I'm a good kid, I'm a valedictorian, I play baseball, I don't really need God. It was the first time in my life I was like, I need something other than me because I can't get through this. And through those injuries, through that process, that's where I felt like the Lord really spoke to me and really showed me hey, there's more to life than just yourself. There's more to life than baseball. And that's really when I just surrendered my life and said, all right, Lord, I'm just going to give my life to Christ. I'm going to follow you. I want to walk after you and follow you. And I want what all those other people have been talking about. I want that kind of joy. I want that kind of happiness because I'm not finding it in myself. I'm not finding it in baseball. I'm not finding it in any of that. And I was very lucky to have some really good sports medicine doctors. I did my surgeries and really kind of helped me when I was in a very low spot. And it really kind of put a bug in my ear that, I want to be able to do something like that. I want to be able to kind of help people and kind of lift people up in their lowest moments. And so for me, I love it when I can incorporate my faith into my work. I love it when I can, have people that come to my office. They may not walk into a church, but they're in my office because they hurt their shoulder or their elbow or their knee. And I can just show them hey, there's more important things than just, medicine and sports. And I can just, try to love them through that episode. And I've had some really cool moments with patients where, the light bulb clicks in their mind now of wow, I love basketball, but I got to look beyond basketball too, you know, and I think we all get to that point in life, whether it's through sports or through life. You know, life just has a way of knocking us down. And I think we all are looking for something to be very stable. And I found that in my faith. And it's really fun that I get to go to work. I get to combine my passions with my faith, my testimony, my love of science and medicine and sports all in one. So like, I feel like a kid on a playground every day. Like I get to do all that together.
Yeah, I mean, I love that you expanded on that because, you know, life is hard, right? Whether if you're a 17-year-old kid dealing with the first injury, and at that moment when you're 17, you and I have been 17, and whatever we went through at 17, that was the biggest deal.
Absolutely.
Not until you live long enough and you have other bigger deals,
Yep.
and you realize like, oh, that was kind of nothing. But I do like the faith-based approach. I do the exact same thing, right? Where, you know, all in all, we're here for a short period of time. You know, I look at myself as a servant for a bigger calling. And if you're here to serve, you will do your best to serve the person in front of you. But not because for your own selfish needs, but it's because that's the right thing to do if you're walking through faith, right? And I think being able to deal with injury, but then kind of be able to zoom out on like, hey, there's more to life than just me playing sport, more to life than me getting a scholarship. And some of my pro guys and pro girls I get to work with, the one that tend to cope really well with adversity are the one who has the most faith, right? Because they can walk, lead by faith, not by sight, which is the best thing you can do. And, you know, rehab is messy. Like life is messy. It's never going to go directly as planned, but there's always a reason why you're put in that position, because you don't know what kind of impact you're going to have, right? I mean, absolutely, it sucks that you have to be in a wheelchair, but if you weren't in a wheelchair, you wouldn't be able to relate to your patient now. So things happen for a reason, and I love that. And I do think that the way medicine should be, and this is why I like sending all my patients to you, is because you're able to have a conversation with them, which make them feel understood, make them feel seen, make them feel heard, but it's also bringing back the old school mentality of, you know, a community-based medical approach, right?
Absolutely.
Like you and I, back in the day, we could go to a pharmacy that know our whole entire family. They'll ask you, how's your mom? Hey, and they know your family history by just knowing your parents. And you're like, hey, you might not want to eat that because you got cholesterol in your family. But now you go to CVS, you go to Walgreens, there's none of that. You know, and I think what you guys are doing at HSS is still one of the few medical places that still honor that, which I appreciate. So because to be able to take your oath seriously, but also communicate with the patient and the parents at the same time in time of crisis, I think that goes a long way, right? Nobody call me when they want to have a good time. Nobody call like, you know what, I want to go to PT today. No one say, I want, you know what, I wonder what Dr. Carr is doing. Let me go get an MRI real quick. It sounds pretty good. Like it's a grudge thing already. But to be able to brighten someone's day in their darkest time, I think that is truly a special gift that we get to do and to share with other people.
Absolutely. No, and it's what makes me passionate about what we do. And I think, and what you mentioned was so true, in that I remember it's like first, second week of med school, I went to Wake Forest Med School, and they're very aggressive at like getting med students to like learn how to talk to patients and learn how to interview them. And we would do these role play. We'd have this class, it was called doctor-patient relationship, where you learn about that relationship and how to foster it and develop it. And it was like the first or second week, and we were doing this role play where we had to deliver bad news. And so, you know, one person was the patient and then I was the doctor, and we had to deliver that they had cancer, and it was a terminal diagnosis. And I was I think 18-year-old, 22-year-old kid at the time, 22, 23-year-old kid. I had no idea like how to do that. I never had to tell anyone any bad news. And it was really, really hard. And I was like, stumbling through it. And I think my face was turning red. I was embarrassed. Like I didn't know what to do. And the doctor who was like my mentor in that said, like, how was that for you? I was like, it was hard. It was like the hardest, and it wasn't even real. It was role play. And he was like, never forget that feeling, because that is how a patient will feel every time when you break bad news for them for the first time. And it's very sobering, because to your point, I see patients all day that come in and they've had injuries. And to me, we live in that world. It's very second nature to us. And we know the big picture that chances are you're going to be okay and we can make you better. But in that moment, they don't know that. This is their first time being in that world. And so, that's why I love working with you as well, is because you're very sensitive to that. And and you treat that whole patient, that whole family, and really it's like, it's not just the patient, it's their family, it's their agent, like it's the PT, it's their dietitian, it's their favorite uncle, and we're all in this together. And I try to never forget just that side to it, and just make sure that I'm relating to patients in that way.
Yeah. Another thing, this might be a little thing that I picked up during your presentation, but I thought it was one of the coolest thing that you keep track of every single cases that you do. Because in my head, I have like the amount of ACL and UCL that we do, and how many that we were able to do really well.
Yeah.
Because you learn from your mistake, right? So, based on that, so I feel like you're able to take what you do at the professional level, right? Because you were with you're with the Mets and also with the Marlins.
Yep. I work with them as well. Yep.
So talk me through about how you're able to take what's going on in the mountaintop and then bring it down to like people like in high school athlete and families.
Yeah, no, absolutely. I mean, I think I love doing that because those are like the light bulb moments in clinics that are fun. So, I have a high schooler that comes in. A lot of times it's a non-operative injury, which is great. They don't need surgery. But it's a chance to educate them on, this is what you have to do to make your body hold up to this kind of level of sport participation. And so I used to use the analogy that, your body's writing checks that they can't cash. But no kid knows about a check anymore. They never heard of it. They've never seen it.
Maybe Venmo.
Maybe, yeah. So now I'll say like you're trying to
pay later.
Yeah. So I'm like, you're basically like making a Venmo transaction with no money in your account. So, but I get to tell them, I'm like, look, everybody looks at DeGrom or Sean Manaea or Edwin Diaz, and they see him perform on the mound, and it's great, but they don't see everything they do behind the scenes. They don't see that when DeGrom or any starting pitcher comes off the mound, they don't put ice on their arm. They give everyone a handshake and high five. They go to the training room. They do 30, 40 minutes of shoulder work, elbow work, rotator cuff strengthening, stabilization, upper core, main core. They get their arm care in, and then sure, maybe they'll ice after that or put heat on or whatever they like to do. In little league or high school or even college, the kid, comes off the mound. If they're not going to go play shortstop, the coach is literally like wrapping the bag of ice before they can even get to the dugout half the time. So just educating them of, look, this is what the highest level athletes do, and this is how they maintain their arm. You need to do the same. And I'll say, how many times do you do your arm care during the season? Usually it's none, or maybe once a week or whatever, and just brainstorm, okay, can we put weights in the dugout? Can we put some bands in your bag? What can we do to just give you some form of arm care activation, and trying to bring that to them? Obviously, a lot of high schools and colleges don't have quite the resources that the Mets or Marlins or pro organizations do, but just trying to educate them on how to do that. And then sometimes it works the other way around. So I started doing my hybrid reconstructions where we put the brace and the graft in for a Tommy John surgery. I started doing that on high school and college kids because I wanted to see how they did. I didn't want to do anything new in a pro until I had a track record of how well does the surgery do in my hands. So I never try to do anything novel or new in a pro athlete. I want to do something that I know will work. Not to say that I'm experimenting on my younger athletes, but it's more of a testing grounds of tinkering with certain techniques or certain things, and allows me to then translate that. But at the same time, if I know it works in the pros, I know it's going to work with them. So it's kind of a two-way street, and it's a fun street to be on.
I mean, it's the risk tolerance thing. Like I do the same approach where our younger athletes are more mobile, pliable, and they can, with being young, you can tolerate a lot of stuff and you adapt pretty well. Where, if you're, like a 10-year vet, right? The last thing you want is like a new thing.
Exactly.
Like, unless you're like, I need a final check, I need to get back really fast, give me the fastest thing, and then just get me signed. Right? Those are also different circumstances. But I think that's where medicine really make their progress is in those gray. We never make progress in a safe zone. It's always in the gray area.
Absolutely. I think we always learn it in the gray area, and we always learn it, honestly, from our non-compliant patients. And if there is a group that tends to be non-compliant, it tends to be the high school college group, just because they're not, my pros, like when we do a surgery on a pro athlete, they're seeing the PT every day. Pretty much all day, every day, they're somewhere around the gym or the complex or the building. High school, college kids, once a week, twice a week, maybe 3 times a week if their schedule allows. And so there's more of that gray zone where they're on the fringes a little more. And that's where I'd have these patients come back and say, hey, I'm already throwing, or I'm already throwing a bullpen, or I'm already playing the sport. And it kind of opened my eyes. Okay, like what is allowing you to do that? And then can that be translated, on a bigger scale? And so, it's a fun, evolving evolving field. If you look at ACL surgery, it used to be a 2-year recovery.
Yep.
Now it's about a 9-month. So I think UCL needs to trend that way, and hopefully we'll get it there.
Yeah, and I think with all the modalities, and even baseline, I think most of the kids that we get now, we got one ACL kid that went back to like running in like 3 months.
Yeah.
But the baseline was great.
Yeah.
Right? So I think kids now are more athletic, and if they're like serious about their craft, they're gonna have better muscle mass, the motor control is gonna be good. But also if they play multiple sport, I think those multiple sport kids tend to do really, really well because they can pick up different skill set much quicker than like the early specialization ones.
Yes.
So you have 3 kids.
Yes.
Right? So
I do,
So what is something in the back of your head? Obviously, you're not going to push sport on them.
Right.
Maybe a little bit baseball for your son.
Yeah.
What is something that you're seeing that is trending in the wrong direction for the kids?
Yeah. Oh, that's unfortunately there's more trending in the wrong direction than the right direction. So I think the biggest thing, and it's hard, is that the lie that you have to subspecialize in a sport at an early age in order to make it in that sport. I've talked to a lot of pro athletes of all sports, NFL, NBA, MLB, as you have as well. And very, very few of them, their story was, I played on a travel team at the age of 9, and I just played that sport, forever. A lot of them was, I went to a D2 place because it gave me the best option. I was a two-way player. I did this, and I just kind of figured I was a little better at this. Or I played basketball and baseball. Well, why'd you choose baseball? I thought I just enjoyed it more, or I thought I had a little bit better future in it. But I think that early subspecialization is definitely going in the wrong direction. The stereotype now is that if you're not on a travel team by 9, then you might as well just give it up. My wife is a CSCS, and she'll do strength and conditioning and speed and agility, and she was doing it for a softball team of 11 to 13-year-olds. And there was an 11-year-old in the group, and my wife was just kind of shooting the breeze during a water break. When did you start doing softball? How long have you been playing? And she said, I'm really late to the game. I just started, and I'm 11. Wow. And my wife was like, what do you mean? You're 11? That's a perfect time to learn a new sport. Like, this is great. No, everyone else here has been playing since they were like 6. I don't know if I'm going to make it because of that. And it was just, it's just a different paradigm shift. So I think that needs to, just let kids go have fun. Let them go have fun. And I think the best thing I heard from a father who has 2 kids who are professional baseball players, one at the MLB, one about to be in the MLB. I was on a seminar, and his kids played 3 sports, 4 sports, a ton of sports throughout the year. And he said, I would rather my son learn how to compete than how to hit a baseball into a net 1,000 times during the winter. So when he played basketball, he came off the bench. So he had to learn, how can I be a good teammate as a bench player? He wasn't the star. He stepped on the baseball field. He was the star that was committed to D1 as a freshman. Like, he was the best player on the field. But when he went and played soccer, he was an average player. But he has to take this penalty kick to win the playoff game. Like, I wanted him to be in that kind of environment, learn how to compete, learn how to deal with failure, learn how to deal with success. Learn how to pick up your team when you only play 2 minutes a game. How do you be a good teammate? How do you respect the coach? I wanted him to learn those life lessons, as opposed to, I'm just going to go, kick a ball into a net 1,000 times during the winter and be one-dimensional. I think in sports, we all say, go play sports because you'll learn a lot of good life lessons. You learn a lot of bad lessons too, if you're not careful. You only learn good lessons if you as a parent, you as a coach, you as a physical therapist, a doctor, are intentional about treating those good life lessons. There's a lot of kids out there that are learning the wrong lessons of, you got to win at all costs. Doesn't matter if you break down your body. Doesn't matter if you pitched 2 games yesterday, you're pitching again because this is the championship, and if we don't win this, you're not going to get a ring as an 11-year-old. And they learn winning over everything at the expense of themselves, at the expense of the team, at the expense of their future. And so I think, that's kind of a long-winded answer, but I think the year-round play is detrimental. I think the specialization is detrimental. Even within sports specialization, the past couple of years, I've had 13-year-olds come in and say they're pitcher only. At 12, 13. I'm like, what do you mean you're pitcher only? Like, go swing a bat, go play soccer. Like nope, all I do is pitch. And I'm like, well, there's a reason you're in my office at 13. And it's because of that specialization, that early. So I think avoiding single sport specialization, avoiding year-round play, developing natural athleticism. I had a baseball coach say, I think every baseball player should not play baseball when they turn 13, when they transition from the little league field to the big field. I think they should just take a year and learn how to be an athlete, learn how to move, learn how to control their body, learn how to squat, learn how to start, stop, run, jump, how to throw properly, how to adapt to that higher level. I don't completely disagree with that.
Yeah.
You know, it's probably a little too extreme, but I think he's onto something.
Yeah, I mean, during that time, that's when not only the feel and the distance get greater, their body's also growing, so they
Yes.
get more awkward. I
Yes.
always say this all the time. It's like seeing kids hitting a growth spurt. It's like running with high heels on. You're not
Yeah,
going to run
yeah.
the same way. The way
Exactly.
you throw when you're 4'9" versus 5'2" is
Yep.
going to be different.
Yep.
And what I've seen the most is lack of body awareness.
Yes.
They just don't understand their body in space.
Yes.
Right. Like there's many instances where we have kids who are dealing with like some elbow pain, non-op, and the one thing we just say, you just don't know how to push off your hips, right?
Yeah.
So
Yeah.
we don't even touch the ball. We say, hey, you got to do some lateral sprints, some lateral bound.
Yeah.
Like how are you
Yeah.
generating force, right? But to your point, is like teaching kids to be a good athlete is the best one. I got a
Yes.
call from a dad yesterday, literally brand new. He was like, hey, my son's 10, really serious about baseball. I heard you're the guy. Can you come in and can I bring him in, work on mobility, flexibility? I say, all right, hold on. What is he doing now?
Yeah.
What's his training look like? He's like, we don't have a trainer yet. I say, here's my advice. Work with a good strength coach that work with kids, develop them over time, get him to be a great athlete, learning how to move, and then everything will fall in line.
Absolutely.
And then if he end up growing really fast and he's putting on a lot of weight and he's losing his mobility, okay, then you can bring him in, we'll do an assessment, we'll give him stuff that he needs to do on his own.
Yep.
At this point, a 10-year-old attention span is not going to be that much. But if you find the right coach and you can connect with that 10-year-old, meet them where he is, and then get them to understand, then you're really going to develop the athletes. And I did tell the dad, I was like, sometimes you need to wait a few years for it to click in his head.
Yeah.
Because I feel like, and maybe it's a guy thing, where, like, you ever, like, go back to middle school, you're kind of like just walking around. You're like, yeah, what was I doing in middle school?
Yeah, yeah.
You're just doing this, and then something in your head in high school just clicked, and you're like, oh, okay.
Yep.
Now I have to, like, lock in.
Yeah, no, for sure. I think letting kids find their path is so important. And my parents, I was very lucky. They let me find my own path with sports, with my career. My dad, I'm sure it killed him to see his son, who was a valedictorian, have a 3.88 GPA in college, neuroscience major, be like, I don't know what I want to do with that. I don't know if I want to go to med school. I don't know. I just want to play baseball. Like, I'm sure deep down, he could see, like, look, you're not going to be a pro baseball player. He never once told me that.
Yeah.
He just let me find my way, and he kind of knew, like, I was going to fall into place. And so, like you mentioned, I have 3 small kids. I want them to do whatever they want sports-wise. Our 4-year-old son's in swim lessons now. He's played some soccer before. He says he wants to play, football and volleyball and golf now is as big. Great, whatever you want to do, like, we'll do it. The only thing I do kind of push him a little bit towards is I do have him swing a bat from both sides of the plate. So I do like to, hope he has a sweet swing on the left side. But yeah, we just want them to kind of find their way. But it's a challenge. Like, my wife, she played college sports. She was a track athlete and a volleyball athlete in college. And, we've told ourselves, like, we're going to really try to, like, back off, not be too intense. But it's hard. Like, as a funny story, when my son was playing 3-year-old soccer, I mean, it's literally just, like, run around the field and herd cats. And there's, like, no, scorekeeping or anything. It's just, oh, yeah, you're out there, go do whatever. First time we're out there, my wife's watching my son run around, and he's kind of like in the back of the herd as they're chasing the ball, and he's kind of like going off and running to the side and, just kind of running wherever. And I'm just like, oh, great, he's out there running, like, he's having fun, great. My wife is like, why is he not following the ball? Where's the coach? Why isn't the coach coaching him? Why isn't the coach putting him back in? When's he going to kick the ball? He hasn't kicked the ball yet in this game. What's going on? And I was like, whoa, babe, hold on.
Yeah.
I was like, you are being that kind of parent that we told ourselves we're not going to be, and this is the first day at 3-year-old soccer. And she just, like, opened her eyes, she was like, oh my goodness, you're right, I'm so sorry, that like, my bad, like, so it's hard, like, I get it, like, it's, we all want to see our kids succeed, we all want to see them, find their passion, find what they love, we love sports are awesome. There's a lot of money in sports now, at lower levels, with the way things have changed. So there's opportunities there, and I get that, and I understand that. But have fun with it. That's what I think I remember most about my playing days was having fun and the goofy moments in the clubhouse and the fun bus rides and the fun practices and the hard practices. The times you get chewed out by the coach and you get through it together and. Like, those are the things you take with you, and those are the things that impact you. So we're just looking forward to our kids hopefully enjoying sports. We joke that if they don't like sports, then we'll be bringing, like, the air horn and the posters at, like, the band concerts, the art shows, or, because we don't know how to be a fan for anything else, but we'll make it work either way.
No, I mean those are. I mean, I love that. Great story. And if you're competitive as a parent, you know you can't help it, right?
Yes,
You kind of have to like push that down a little bit. Like I joke with my wife all the time. It's like, yeah, you know, she's gonna have my height. I'm 5'7". She's 5'4".
Yeah.
I was like, she'll do weightlifting, whatever she wants to do.
Yeah.
But I think that's what's cool about being a parent and also being in medicine and get to do what you love, because you get to see. You get to see kids and family at their darkest time facing uncertainty, and then you get to see how they rise to the occasion.
Yeah.
And if anything, what I've learned so far is that you need to let the kids go through that whole process.
Yes.
You need to let them fall. You need to let them, but be there for them as they try to slowly pick themselves back up. This is probably the first time in the kid's life where they have to deal with something on their own. No one's doing the exercise for you. No one's waking up. Like they can wake you up to send you to PT or to come see you, but you still have to take ownership of your own body. So I think it's a great lesson, and there's no way to bypass that. And if I have parents coming in, I say, hey, you gotta let him or her sit with this.
Yes.
It sucks. Like you have to learn how to sit in the trenches, and then so you know what it's like to come out of the trenches. So last question I have for you. So if you were to be able to put a nice billboard, which I see HSS put a nice billboard up there, but it's for you personally, what would that billboard say?
Oh man, I am not a self-promoter.
Yeah.
I try to leave that to other.
Could be a quote, whatever it is that you wanted people to see.
What would my billboard say? I don't know. I mean, I don't know if this is what the billboard would say per se, but I always have patients that tell me like, oh, like you're the man, or my daughter, son, whoever, they're in your hands. And I always just say, look, like they're in the Lord's hands. You know, He's the great physician. We're just His hands and feet. You know, like we're here to serve. There's nothing special about me or about, my hands other than the fact that they're an extension of the great physician. So I would probably have it say something along those lines, because I think that's, important. I had a mentor that told me that healing belongs to the Lord. And I firmly believe that. I can do a perfect surgery and sometimes it just doesn't work out. I can do a perfect surgery and it works out great. I can have a surgery that's tough and the anatomy's hard and you do your best and the patient does amazing. So it really is like, it's all in the Lord's hands and we're just His hands and feet. And I would probably have it say something along those lines. Because it's not about me. It's not about me. It's not about my skill. It's not about your skill, as skilled as you are. It's about, being those hands and feet and serving and just being that vessel to our patients.
No, Dr. Carr, thank you so much. I really appreciate this conversation. It's fun. And then if people need to find you, I will put that in the show note. Make sure to put the website and way to contact you.
Awesome. Yeah, always here. Happy to help. And it's always great working with you. I appreciate it, Natty.
No, thank you.
Thanks again for having me.
Yeah.